Psoriasis has long baffled dermatologists, immunologists, and more than a few frustrated patients trying to decode why their skin is suddenly staging a rebellion. Red, scaly plaques flare seemingly at random, as if the immune system mistook the epidermis for an invader and decided to burn it down, again and again. But while the usual suspects, hyperactive T cells, cytokine storms, and genetic predisposition, have dominated the conversation, there's a new culprit entering the scene with all the charisma of a forgotten zombie in a B-movie: the senescent fibroblast. Fibroblasts are the behind-the-scenes crew of the skin. They produce collagen, elastin, and a host of signals that coordinate tissue repair and immune balance. But when fibroblasts go senescent, entering a state of irreversible growth arrest, often due to stress, UV damage, or chronic inflammation, they don't just shut down quietly. Instead, they adopt the infamous senescence-associated secretory phenotype, SESP, spewing out a witch's brew of cytokines, proteases, and growth factors. Think of it as a cellular midlife crisis that's both loud and inflammatory. In psoriasis, where inflammation is already cranked up to 11, adding zombie fibroblasts to the mix may be like pouring gasoline on an already unhinged bonfire. Here's where it gets weirder and more interesting: not all senescent fibroblasts behave the same. Recent single-cell RNA sequencing studies suggest there are multiple subtypes of senescent fibroblasts lurking in the dermis. Some act like cytokine factories, with high expression of IL-6, IL-1S and TNF-alpha, molecules already central to psoriasis pathogenesis. Others are matrix disruptors, secreting enzymes like MMP1 and MMP3 that chew through collagen and compromise the skin's structural integrity. There's even evidence for an immune mimic subtype that expresses MHC class II molecules and can activate T cells, essentially turning fibroblasts into antigen-presenting mischief makers. This raises an obvious and slightly alarming possibility that senescent fibroblasts don't just amplify psoriasis, they may help initiate it. Chronic skin stress, whether from mechanical injury, the Koebner phenomenon, infection, or UV exposure, might tip a critical mass of fibroblasts into senescence. Once enough of these zombies accumulate, they could start reshaping the skin environment in ways that invite immune overreaction. They could lure in dendritic cells, prime autoreactive T cells, and maintain a feedback loop that makes flares hard to extinguish. In this model, senescent fibroblasts are not just passengers in the inflammatory ride, they're driving the damn car. What makes this even more compelling is how well it dovetails with the patchy, localized nature of psoriasis. If senescent fibroblast subtypes are unevenly distributed across the skin, they could create hot zones of inflammation that flare unpredictably. It might also explain why some psoriasis lesions remain stubbornly resistant to treatment. If senescent subtypes have taken root deep in the dermis, simply shutting down IL-17 or TNF pathways might not be enough. The zombie cells are still there, muttering pro-inflammatory mantras and undermining the peace. Naturally, this opens the door to some tantalizing therapeutic possibilities. Could senolytics, the drugs designed to selectively clear senescent cells, help calm chronic skin inflammation in psoriasis? Could a topical formulation target just the harmful subtypes, preserving fibroblasts needed for repair and homeostasis? We're not quite there yet, but early work in mouse models suggests it's possible. Senolytics like dasatinib and quercetin have already been shown to improve skin function and reduce inflammation in other age-related dermal conditions. If they could be refined to target psoriasis-specific senescent profiles, we might have a whole new class of adjunctive therapy, one that goes after the cellular environment, not just the immune system. Even diagnostics could evolve. Imagine a skin biopsy, not just graded on histological inflammation but profiled for senescent subtype burden. If a patient's lesion is rich in pro-inflammatory SASP fibroblasts, that might predict severity, chronicity, or even resistance to standard biologics. Precision dermatology, now with added zombie surveillance. Of course, we shouldn't over-romanticize the role of senescent fibroblasts. Psoriasis is still a complex autoimmune condition with genetic, metabolic, and environmental layers. But like any good mystery, sometimes it's the overlooked character in the background, the quiet, aging fibroblast, that ends up holding a crucial clue. And if these cells are indeed helping stir the pot in psoriatic inflammation, then it's time we stopped ignoring them and started listening to what their malfunctioning, cytokine-soaked whispers are really saying. Because maybe the path to healing isn't just about calming the immune system. Maybe it's also about dealing with the cranky, inflammatory zombies we've left behind in our skin.